going to wait a couple of minutes. Thank you, Carrie, for remembering to hit that button. Fantastic. Okay. Michelle, shall we wait another minute or so to get started? Well, I hope everyone is enjoying this beautiful sunny day. It says we're at 19 degrees and we have our air quality at a 3. So that's a positive note. So we're really happy to have everyone who is here with us this morning. We're pleased to welcome you to our Realizing Healthier Pregnancies Research Cluster. Thank you for joining us today. My name is Shannon Cornelson. I'm a research assistant in the Faculty of Medicine and Dentistry at the Women and Children's Health Research Institute, and I'm pleased to serve as the session moderator of our presentations today. And on behalf of WICRE, thank you for taking the time to attend our session. Now, I am going to share my screen very quickly as we go into our land acknowledgement, because I believe this is something that we should all be doing every day. So the University of Alberta acknowledges that we're located on Treaty 6 territory and respects the histories, languages, and cultures of First Nations, Métis, Inuit, and all the First Peoples of Canada, whose presence continues to enrich our vibrant community. I would also like to thank WICRE's funders, the Stollery Children's Hospital Foundation, and the Alberta Women's Health Foundation for making this research cluster possible. And this session is taking place on Treaty 6, the traditional lands of the Nehiyawak, the Cree, the Dene, Nakota Sioux, Saulteaux, Blackfoot Nations, and the homeland of the Otipemisiwak, or Métis people of Alberta. And as we move into this, thank you so much for joining us today. And WICRE is actively seeking to build this research cluster. I'm going to stop sharing and put us back to the main. Now, please reach out to WICRE to join the cluster, to nominate your collaborators or networks. WICRE's email is in the chat, and Michelle from WICRE will stay in this session to answer any questions that you may have about participating in this research cluster. This session will be recorded and posted to the WICRE website. WICRE will send out the link to the recording, and please allow us 24 hours to access the session recording. We're looking forward to sharing our research with you and encourage questions after each presentation. Now on to the main event. I'm pleased to introduce Richard Oster and Luwana Lister from the Wâhkohtowin Research Group. For over a decade, Wâhkohtowin Research Group has collaborated with the Nehiyawak, the Cree communities of Musqueam, in research aimed at supporting healthy families. Dr. Richard Oster is an academic partner of the Wâhkohtowin Research Group and scientific director of the Indigenous Wellness Core of Alberta Health Services. Richard's research takes a strengths-based and partnership approach, building specifically on Indigenous ways of knowing and the resilience and abundance within communities. Richard is pleased to present with Luwana Lister. Luwana is a community-based research coordinator of the Wâhkohtowin Research Group, and with research experience and expertise in intergenerational cohesion, pregnancy, maternal health, gender, and wellness. Richard, can you and Luwana please take the floor? And I believe we're looking right now at Carrie's emails. Yes, we are. So I think we're just going to switch over here in just a second, but I'll pass it over to you, Richard.
Yes, we're ready to go. I see the slides are coming up. Perfect. Okay, beautiful. So, hi everybody. Welcome to our Wâhkohtowin Research Group session today as part of the WICRE Realizing Healthier Pregnancies Research Cluster sessions. So as was mentioned, I'm really honored to co-present today with an amazing friend and colleague, Luwana listener. And Luwana is our senior community research coordinator for our research group. And she's leading a lot of the community-driven maternal, child, and family health research work that we're doing with Wâhkohtowin. Luwana will have some time to introduce herself a bit more in a few minutes. So we're here today to talk about culturally based strategies that we are implementing with the community of Wâhkohtowin to improve maternal health and to build healthy families. So we're part of a equitable, community-driven, community-led, strengths-based research group that we call the Wâhkohtowin Research Group. And I think I can speak for Luwana that we're really excited to share with you a bit about our strengths-based approaches and the intent of our research and some of the amazing things we feel we can do from working in partnership in this way. Okay, next slide. So here's a summary of what we'll try to cover today. So we will describe the intent and the aim of our long-standing research relationship. We'll try to illustrate some of the strengths-based principles by which our group functions, guided by the concept of Wâhkohtowin, that we're all related. And we'll share some of our community-led research strategies that we have right now, aimed at supporting healthy family systems in Wâhkohtowin. Next slide. So we want to take a few minutes to introduce ourselves and situate ourselves. So as was mentioned, my name is Richard. My spirit name is Wâhkohtowin, which means white horse in Cree. And in terms of who I am and kind of where I come from mixed European descent. I'm a mix of German and Danish, Scottish, Austrian, and Ukrainian. That's what I know. There could be more mixed in there. I'm not entirely sure, to be honest. But since birth, I've called Treaty 6 territory and Métis North Saskatchewan River territory in Alberta my home. So our family has lived here for about 4 generations now, and I've been really privileged and lucky to partner with a number of Indigenous communities and organizations and peoples in Alberta for about, I don't know, 12 or 13 years now through research. My day job is scientific director with the Indigenous Wellness Core of AHS. I'm also an adjunct assistant professor at the U of A and the U of C, but I don't know, those are just work titles, and honestly, they're ones I don't typically feel super comfortable with in my work. In fact, I don't really like the job title of scientific director. I tried changing it. They wouldn't allow me to, because I don't feel like I'm directing anything, and I shouldn't be directing anything. I'm more of like a scientific partner or cheerleader. That's what I would prefer my job title would be, because I'm not an expert in Indigenous health. I don't ever claim to be. I'm just a guy, a lucky guy that's working alongside Indigenous communities and peoples in research with the common goal, I guess, of diminishing the existing health disparities. And much of the work that I do tries to harness the immense strength and resilience within communities. And much of it is focused on supporting healthy pregnancies. So a little bit more about myself. I'm the proud dad of two teenagers seen here. They're 17 and 16 years old. Um, they don't really know how often I show pictures of them in presentations and work settings. And I think at this age, if they did, they'd be like annoyed and would say I'm being cringe or cringy or whatever. They would be embarrassed for sure, but they're not here today. But it's important for me to mention them. And also my wife, Michelle, the most amazing person that I know. Okay, next slide. So over to Luwana to introduce herself.
Thank you, Richard. Welcome, everyone. It's a pleasure for me and an honor to be able to share our work with everyone. My name is Luwana Listener. I am from the Ermineskin Cree Nation of Musqueam, as well as the Blackfeet Nation in Montana. And so I grew up in both areas, but I consider Musqueam my community. My educational background is in education. I was an elementary school teacher for 12 years in California. And so it's really great to be back in my community, doing work for my community, and it's a real blessing. I've been involved in since 2016, and I've had the honor to be able to work with my community, for my community, and just do projects that are really meaningful and give back. So that's really important for me. And so I have some pictures here of my ancestors. So the black and white pictures are pictures of my ancestors. And it's really important for me to keep them in my heart and in my mind. So I want to be able to know that I'm making my ancestors proud with what I'm doing and how I'm living my life. And the middle picture is a picture of myself and my mom and dad. I just wanted to share that. It's just really good. Okay, next slide.
All right. Thanks, Luwana. I think it's back to me for a little bit. So over the next couple of slides, I'll describe some of the history of our research group and our partnership and the principles by which we work. And then after that, Luwana will take over and describe some of our current research activities. So to set the stage a little bit, I'd like to provide some context of our incredible and I think really novel and unique research partnership. So we've been in a knowledge-seeking relationship and partnership since about 2012. And over that time, our team has seen many evolutions. We've had many community members involved, and we've done a lot of cool things. When we started, it was just myself going out to the community as a young PhD student, building relationships and getting to know the community. So I would say we started in a community-based research approach where, over time we've tried to adapt that and evolve that more and more towards a community-driven and empowered research approach, where it's community members that are in full control, doing the research themselves for their community, and where it's people like myself that are supporting more on the sidelines. I believe we're there today, and I'm really proud of that. Today, our purpose is to work together to improve the health and well-being of women, children, and families through research in the community. And it's very important for us to use responsive, reciprocal, and relational approaches to our work. So that means research for communities that's relevant to them, and where we're building and strengthening relationships. And that's really the foundation of what we do. And where community members are leading throughout all aspects of the research. We also work from a strengths-based or solution-oriented way, and I'll speak a little bit more about that, I think, in the next slide. But in short, that means building from the great strength and hope and opportunity in Musqueam. So over the last 12 years, we've, I think, conducted now about 18 different research projects together, many of which were focused on perinatal well-being. I don't have the time to go into all of those, but we've done a lot of work. And if you're interested in hearing more, you can always reach out to us. We can share research papers and other reports that we've created. In terms of our current structure as a team, we're now truly in that community-driven approach. So we have a core team of community researchers that are from Wâhkohtowin. So Luwana is one of those core team members. And the core leads all aspects of our work. They make the decisions. They carry out the research activities day to day in the community. And that core team is supported by many people, including an engaged group of elders and community members that we call our Community Advisory Committee, as well as academic partners such as myself and Dr. Rhonda Bell, and additional community partners and organizations such as Wâhkohtowin Health Services. They're a big partner of ours. So this isn't how research is typically done in my experience, and it wasn't easy for us necessarily to get to this place as you might imagine, and we'll, I think, talk a little bit about that. All right, next slide. So for those of you that aren't familiar with Wâhkohtowin, it's a rural community about an hour's drive south of Edmonton within Treaty 6 territory. And it's made up of 4 distinct Cree First Nations bands. So there's Samson Cree Nation, Ermineskin Cree Nation, Louis Bowl Tribe, and Montana First Nation. And it also includes the Pigeon Lake Reserve, which is about a half an hour away from Wâhkohtowin. And give or take, there's about 200 births per year, and there's about 20,000 residents. We don't have the time, and it's not my place to get into the history and context of this unique and beautiful community. I'm sure Luwana will share a bit more, and she'd be happy to answer questions about the community of Wâhkohtowin. But just to give you a brief, little bit of context. Okay, next slide. So now that we have a bit of background and idea of why we're doing what we're doing, we'll discuss some of the principles of how we work together. So these principles have taken a long time to develop through years of working together and evolving our processes, gaining experience together. We think of ourselves as a learning research group. So we're not stagnated in the ways in which we work. We continue to evolve over time. I think our main principle, I would say, is working from a strengths-based perspective. So the vast majority still of Indigenous health research is primarily deficit-based, focusing on what's wrong with the community that exists. But it's really important for us to focus on the strengths that are inherent in community and change that perspective of research. And I think we found that people can get behind and want to be involved more in research that's coming from a positive perspective, telling positive stories that exist within the community, rather than ones that just continue to talk about the disparities. And I think it creates opportunities and solutions that otherwise would not be created by academic institutions. It allows also for much needed self-determination and autonomy of community members over their own research. And for us, this also leads to empowering people within the community. Luwana is a prime example. Those that have the strengths and the power to change their lives, and those in the community in positive ways. So we think we can tell different stories through our research, ones of strength, and focusing on positive solutions and positive aspects of health, and positive approaches and solutions to negative health issues. And I think the last thing I'd say about our strengths-based approach is that for us, it helps us reframe the issues that we're trying to tackle, such that they're not shaming the community, but rather shaming the influences of the disparities, right? Like the impacts of colonization and westernization that we know the root cause. Okay, next slide.
Can I just say something about strength-based? One of the things that we're doing with our work is we're helping to change the perspective of research in the community because, in the past, it's been a really, a negative experience, and a lot of people in Indigenous communities have trauma, or they have, this negative perspective of research. And so it's been a real blessing to be able to go out into the community and tell people that we're doing strength-based research. We're focusing on the strengths that are already exist in the community. The elders, the culture, language, and ceremony. Those are just some of the strengths that exist in Musqueam. And it's been really meaningful for me to help to change that perspective of research. And because when I first started, when people first heard the word research, they would shut down or they would get angry at me. And now I'm able to tell people we're doing strength-based, community-led research. And so it's really great to be able to help to change that perspective. Okay, thank you. Now we can go to the next slide.
Yeah, that's really important context to add. Thanks for adding that in. I'm almost done. I have a couple more slides and then I'll pass it over to Luwana. So in addition to strengths-based approaches, a couple other really important principles for how we work. So relationships and trust. So for us to partner means to have a foundation of authentic, emotionally invested, and meaningful relationships. We try to engage with each other like family, and our work progresses at the pace of trust and at the pace of the community and at the pace of our relationships. So that requires a lot of reframing, at least it does for me, of kind of Western perspectives and overcoming long-standing institutional barriers so that we can put trusting relationships as the focus of our work rather than just a means to an end or some sort of checkbox that we check off. In addition to that, reciprocity is a common thread, as we really believe, as Luwana just, talked, like the research needs to benefit the community. It needs to be for the community rather than just benefiting academic researchers. So together we seek that kind of mutual understanding and two-way learning and mutual benefits and really kind of a level playing field from which we work together. Next slide. We also work in a ceremonial way. So that means we're placing the community's voices at the center of our work. And it means we come together in ceremony often throughout our work in many different ways for lots of reasons. I think one of the things I've noticed is that our relationships that I just mentioned tend to flourish when we meet in that deeper ceremonial way. I think like there's a lot of mutual respect that happens in ceremony, a lot of personal vulnerability and compassion and kindness and humbleness and just spiritual connection. And really like a responsibility to one another that transcends the kind of Western concept of relationship that I'm more used to. And I think from that mindset, we approach our work from a different way of thinking. Like if we come at it from a ceremonial based thinking, Elder Rick Lightning, one of our key elders, says, anything is possible with that mindset. We can do anything. So that's really like an empowering and uplifting way to think about our work. It's also really important that as I've mentioned probably 10 times now, that our work is community-led and community-owned. So it's the community members that are the experts in the issues affecting them, period. And they have the right to self-determination over the research that's about them. Next slide, please. Okay, so I'm almost done. Humility is really important for us. It's really important for me. This is where our egos and any hierarchy has no place. It's where we make space to acknowledge and explore and kind of reconcile that we come from different backgrounds, we come from different systems of learning and different ways of knowing, and we deliberately open our minds and our hearts to each other's perspective. And we see that as another strength, that we come from a different background, from a different way of knowing. And when we can bring those things together, those individual strengths of people, we can really build something. And finally, we've learned that our work needs to be really flexible and adaptable. It can't be prescribed. Um, we need to privilege the community's priorities that, come up day to day. We have to go at the pace of the community, and um, trust takes time to build. Relationships are complicated. They cannot be forced into a preconceived, prescribed timeline. So sometimes that's a challenge, I think, when we come up against the university or funders to advocate for that flexibility and adaptability. But that's one of our principles that we know we need to work by. So I think that's all I'll say for now, and I'll pass things over to Luwana again to share her perspective and some of the current research our team slide.
Thank you, Richard. Okay, so we're part of the iHealthy research, so Indigenous component of the Healthy Life Trajectories Initiative. So we are this work began in 2018, and we're in a partnership with over 20 Indigenous communities in Alberta and in British Columbia. And our overall goal is to support optimal health during preconception, pregnancy, and postpartum for diverse Indigenous populations through community-led and community-specific strategies that promote the best possible healthy life for families and children. Richard, would you like to add anything about the iHealthy?
It's a huge project. It's the Indigenous component of Healthy is just one arm of international research that's happening around the world. It's funded by CIHR. I think like the focus is to develop a cohort of Indigenous families that we can follow over time. And we'll share a bit more about what that means for Wâhkohtowin specifically.
Yeah. Next slide. Okay, so iHealthy and Wâhkohtowin. Like Richard said, it's going to be a cohort study where we're going to follow the families in Wâhkohtowin over time. We decided that anyone will be able to join the cohort. So we were focusing with the Cree concept Wâhkohtowin, where everyone is related, we're all interconnected, we all belong. And so in our cohort study, we're going to include families, so anyone who wants to be involved in the research. It's been built upon years of community engagement and community-driven data generation to help best support families in the community. Based on early research with the community, 3 support strategies will be put into place aimed at connecting families to elders, ceremony, culture, language. And so our 3 community strategies are the Elders Mentoring Program. So in the Elders Mentoring Program, we have the Mom Support and Healing Circle, we have Deadly Dads, and then our last one, which is still in development, is the community guide. So the main outcome measure for us, as Richard stated, is to collect stories of community members over time, where we will we're going to capture their stories through authentic relationships, and all of the data is owned, held, and controlled within the community. Next slide. So here, like I said, our group is Wâhkohtowin, so it's based on that Cree concept that we're all related. And so we have these 3 strategies that really fit well because they're supporting the whole family. So we have the Mom Support and Healing Circle, we have Deadly Dads that helps with the fathers and the males in the family. And then the third one would be the community navigator / guide. Next slide, please. So the Mom Support and Healing Circle, I'm really, really excited to be involved in this. So the Elders Mentoring Program, it provides a space for parents to receive mentoring and support from the elders in the community through communication, conversations, teachings, and just being there as support for the mothers in the community. So previously, the Elders Mentoring Program was located in Wâhkohtowin at the PCN office, where elders would connect parents with teachings and support while they're there for their prenatal visits. Since COVID, the program has been going through a transitional phase to ensure that it is truly community-based, community-led, and it's relevant to the parents in the community. So moving forward, we transformed the Elders Mentoring Program into this new program, the Moms Support and Healing Circle. And so it's a safe space for moms in the community to connect with other moms, to connect with elders, ceremony, culture, and language. And the purpose of this research and evaluation will be to support the creation of a program so it's completely tailored to the needs and desires of the young moms in the community while gaining a deeper understanding of their parenting experience. And we just recently finished we had a 3 session pilot study. So we had different topics, and moms attended, and we had elders there sharing teachings related to each topic. And it was really nice to sit in a circle with moms and just to support each other, to share resources, and to learn these valuable teachings from elders. Tomorrow we're going to be having another session, and it's completely tailored to what the moms said they wanted to see more of in the Mom Support and Healing Circle. So tomorrow we're going to be doing medicine picking and learning how to put up a teepee, as well as receiving teachings related to each of those. So I'm really, really excited about that. And I'm just really blessed to be able to help create this Mom Support and Healing Circle for the community, because we've received already very positive feedback that it was really needed. The moms really look forward to this. They're really appreciative of the teachings and just being there, as I said, in a group of women and sitting in a circle and just talking. It's just been really, really amazing to be able to do this with my community, for my community. Next slide, please. So another strategy that we have is the Deadly Dads Support Society. And this actually came out of the research with the Elders Mentoring Program. So we had different interviews, and we had community engagement, where we found that the moms want the dads to actually be involved. And so the Deadly Dads Support Society was created. So men have an important role to play in supporting the families and caring for future generations. Knowledge of the man's role in healthy and strong kinship networks have long been passed down through Nahil culture. More recently, Western research has begun to explore and show the positive impacts of involving fathers in pregnancy and parenting programs on the well-being of mothers and the developmental trajectory of children. The overall aim is to support Nahil Napeo, which is Cree men, during pregnancy and parenting with community-led, culturally appropriate, and strength-based supports. The objective of this research is to understand the impact of these supports on the well-being of men and their families. And with the Deadly Dads, there's so many wonderful things that happen with this. Just recently, they were planning a traditional, like a cultural camping trip for the families in Jasper, and unfortunately, it had to be canceled due to the wildfires. So they're planning something in August for the families. So it's really great. Like being in the community and talking to community members about Deadly Dads, I always get like so much excitement and positive feedback when I talk about Deadly Dads and how it's a support group for dads. We connect them to culture, language, ceremony, and elders, and just teachings and different activities and getting the men together. The community gets really excited when they hear about this strategy. Okay, next slide. Okay, our last slide is the community guide, and it's still in development. This idea came from digital and physical resources that has been created and made available in the community. So we had a team member put together a Musqueam's community guide that includes resources, supports, and information related to programs in Musqueam's. And so what we're hoping is this role of the community guide will be like having the Musqueam's community guide booklet personified. So this person would be a part of the research group. They would help to direct Musqueam's families to culture, ceremony, community resources, clinical resources, elders, programs, anything in the community related to parenting, maternal health, and healthy families. The purpose of this strategy is to navigate, advocate for, and connect mothers, dads, and families to community resources for cultural learning, spiritual connection, and that information related to prenatal and postnatal and all the different programs that are related to that. So each story is different. Each individual and family may have unique needs. And so it would be really valuable to have this role to be able to connect these unique needs of the families to all these different resources that exist within the community and surrounding areas. Next slide. So culture, ceremony, and Nihilewewin Cree language connections. Culture, ceremony, and language connection for youth and families was prevalent in all the feedback from the families and the parents for creating overall family wellness. Community members spoke of the need to reconnect youth to culture and ceremony as a source for restoring healthy family systems. They also named the need for teachings related to Wâhkohtowin, good child rearing, land connection, and ceremony. So the three strategies that I spoke on, the Mom Support and Healing Circle, Deadly Dads, and the Community Guide program will continue to support this connection and learning. Next slide.
I think that's back to me. Thanks so much, Luwana. We're pretty much finished. Just to sum things up, we believe that by working together equitably and developing trusting and respectful relationships, we can transform Indigenous health research and move beyond the unique challenges that Indigenous peoples encounter by identifying and highlighting the strengths and resilience within communities and incorporating them into relevant solutions. Next slide. So this is our thank you. Thank you everyone for attending and listening. We're happy to answer some questions if there are any in a moment or two. We always have too many people to mention and thank, many of which are not listed here. Over the years, we've simply worked with too many people, too many amazing people. That said, we must acknowledge the communities and people of Musqueam's, the additional core team members, so Sunny Lightning, Marissa Saddleback, and Denise Lightning, or Denise Young, sorry, not Lightning. Our amazing elders that we've worked with over the years, our community advisory committee members, our past research team members, our community partners, so Musqueam's Education Schools Commission, Musqueam's Cultural College, Maskwacis Health Services, Maskwacis Ambulance Authority, and the Early Years Program, and many others. Lots of additional partners, can't mention them all, but important to mention Dr. Stephanie Montesanti and her partners in Wood Buffalo as they're part of our iHealthy project, as well as Lynette Lucas and research partners from the Nuu-chah-nulth communities in coastal BC, and the Alberta First Nations Information Governance Center. So these three groups are all involved in our iHealthy research. Also the Indigenous Wellness Corps of Alberta Health Services and many others. We have to acknowledge our funders for sure, who have supported different research projects we've done over several years. So including WICRI, CIHR, Alberta Health Services, and the MSI Foundation. And the last thing I would say is that we are hiring soon in our Wâhkohtowin Research Group. So we will be looking for a university-based research support individual that takes lead from our core team, so from Luwana and the rest of the core team. This position is currently being evaluated and hopefully will be posted within the next couple of weeks. So if anyone's interested in hearing more about that posting, you can reach out to Luwana or myself. And we're also always looking for graduate students that might be interested in this type of research. So again, if there's any interest in that, please reach out to us. Luwana, is there anything else you'd like to say before we end? You're on mute.
Oh, I did that again. And I'd just like to thank everyone for attending the session and allowing us to share our research with you.
Well, we certainly want to give you a big thanks for sharing all of this really insightful and impactful information with us. Definitely your research is strides above so many different things that are happening for Indigenous people across all of Canada. So thank you so much, both of you, for taking the lead in this. We're going to be moving through here. I will ask you to just raise your hand, as Oana has already done, and we will get to answering those questions. And if you would just like to, if you're more comfortable putting your questions into the chat, you can do that as well, and we'll attach as much information as we can and get those questions answered. So first question, Oana.
Thank you very much. And I apologize. I meant to put the question in the chat, but I was afraid you are going to close the conversation. So that's why I came online. And thank you very much, Richard and Luwana, for this talk. It's very important to hear about your work. I have a very practical question. I would like to understand the connection between the Indigenous Wellness Core at AHS and the Awasisak group. I do a lot of work in genetics, in pediatric genetics, and we do connect with the resources for the Indigenous patients. I think this is a fundamentally important to have that involvement whenever we see patients who are Indigenous. I find that the encounters are very different when that happens.
So the connection between Indigenous Wellness Corps and the Awasisak program at the Stollery? Yeah?
Right.
Yeah. I know a little bit about that as I'm part of the Indigenous Wellness Corps leadership group. Some Indigenous Wellness Corps staff work at the U of A hospital, including at the Stollery. So there's some overlap there. And I would say that Indigenous Wellness Corps would only have kind of a guidance and leadership role to play, but not very directly with the Awasisak program. So the leadership group of Indigenous Wellness Corps helps to set some priorities for programs across the entire province. So that would include the Awasisak program. But of course, they're their own autonomous group that can do the work that they see fit. But sometimes we interact with them. I don't know if that answers your question very well, but.
So I think the group is the Awasisak is mostly related to the pediatric age, if I'm not mistaken.
Yes.
So I'm also interested about adults, because in genetics we see adults, and I find that the resources and accessing people from the community in cases of adult Indigenous it's a bit harder. It's easier with kids somehow. Somehow I'm not sure. Maybe I don't know the structure. If you can explain that, if there is something similar to the pediatric age for adults.
No, I don't, not that I'm aware of. There, like you mentioned, Owasisek is focused on the pediatric population and is connected to the stollery, and I'm not aware of a similar program in the province for adults. There are different resources for Indigenous people within AHS to access. So there's the Indigenous support line, which is a 1-800 number similar to HealthLink, where they can call and speak to an Indigenous person on the other end of the line and navigate the health system. There's the Alberta Indigenous Virtual Care Clinic, so where an Indigenous patient anywhere in the province can call the clinic and have an appointment probably the same day or the next day with either an Indigenous physician or a physician that has a lot of lived experience in working with Indigenous communities. So those two resources might be ones you could reach out to for your need. I'm not sure.
Right. So I'm just kind of advocating for adults, because I think, you know, they are very important, and I find that when we have the representatives from the group coming to our NICU meetings, you know, so with children, it's a very, very big contribution. And I feel from what I hear from you, Richard, that kind of that's missing in the adult world. And I'm wondering if that's something that can be addressed.
Yeah, so I agree. It is missing. I think this isn't the solution, but there are, to what specifically you're talking about, but there are many cultural liaisons at the different AHS hospital sites that you could think of interacting with. And there's more and more Indigenous patient navigators that are being put in place at different AHS clinical sites. So these are Indigenous people that usually have a healthcare background, that like a nursing background, or maybe paramedics, sometimes social work backgrounds, that help any Indigenous patient, whether they're adult or child, navigate the complexities of the system.
Thank you.
Thank you for that question. We're going to move on to Brandy now.
Hi, thank you so much for what a wonderful presentation. Very inspiring, Miigwech. I'm Brandy. I'm from Winnipeg, Manitoba Treaty 1 territory, and I work here with the Anishinaabe Nations in terms of maternal child health and sort of culturally safe and competent care. So I have two questions, but I don't want to take up all the time. So one is, and maybe Luwana, you can shed some light on your own journey, but in terms of the engagement of Indigenous youth in STEM and having community-based research partners, and so we work with elders, and obviously we fairly compensate the people that we work with, but it is sometimes hard, maybe because of the historical trauma of research and a lot of the mistrust, to engage young people. And also a lot of them will tell me, well, I don't know how to do research. Like, I don't know research. And, we tried to train youth on research methodology in terms of both ways, 2 eyes seeing. And we haven't found really good training programs that really are trauma informed or culturally based. And so I'm wondering if you can reflect on that for me, or if you know of anything, or if you use something in your own projects to help with that, navigating the difference between knowledge keepers and knowledge base and traditional knowledge that comes from community, and Western-based, how we collect data and CRF forms and that sort of thing. And then my other really quick question is about OCAP and data sovereignty. And so I heard you say, you know, that we collect data in community, we keep data in community. We've had a lot of struggles with that. Obviously, ours are sort of REDCap university based, and we've done some formalized legal agreements with different nations in that manner, but have yet to find the way to step to the next place where there's a database owned by First Nations, you know, and led and run, and the data is analyzed within a First Nations community by First Nations. And I'm wondering if you have any, I know it's a huge question, sorry, any quick thoughts in the next 10 minutes on that. And I just want to say again how much I very much enjoyed your presentation.
Thank you. For your first question, I don't know of any like programs that kind of like blend the two together, but there was a book that popped into my head, and I'm not sure if you've heard of it. It's Research is Ceremony by Sean Wilson. It's a really great book about, you know, just like what you were describing with the Western, you know, research, and then, you know, the Indigenous ways of knowing. So I found that book to be really, really great with, you know, helping my research journey. Richard, would you like to speak about her second question related to?
Sure. Yeah. So as you can imagine, with 4 individual First Nations that collectively make up Musqueam, it could be very complicated how we would tackle OCAP and having data held and stored and stewarded within the community. For us, it's been crucial to have Musqueam Health Services as a partner. And I know that, you know, that type of partner isn't necessarily available in all the different communities across the country, but it's been the key for us to be able to do that, at least for now, because MHS, you know, has the infrastructure to hold the data. They're, you know, a big organization that can apply for their own research grants and, you know, carry out their own activities. So we work with them. Our data server is set up through Musqueam Health Services at this point, so it hasn't been as difficult as it could have been. So if you can find a partner like that, there's other ones within the community that we've talked about, maybe working with, like the Musqueam Cultural College, for example. But we are, like, our group and others that are working in the community doing research are thinking about a more, I guess, 4-nation and permanent solution that's, you know, really truly community owned and run. So there's a young, brilliant PhD, soon to be professor from the community named Grant Bruno that's been a part of our group in the past. And he is working with us to bring together other academics and community members doing research within the community to this end of, like, trying to come together and think of data sovereignty. How can we create a space? What does that look like? Where kind of like a overarching research group for the community, and that part of which will tackle the issue of data sovereignty. So I don't know if that helps you at all, but for us, we've been lucky to partner with MHS.
Yeah, thanks. No, really good ideas. Thank you both.
I just wanted to go back to your question about engaging with the youth. I just received a text from one of our team members, and she kind of answered that question a little bit. So what we do is we simplify the processes. So we meet each individual where they're at in the conversations when we're engaging with the community. So that helps with engaging with the youth. It's just simplifying, and then maybe just like using language that's more relevant to them. Yeah.
Thank you very much, Luwana, for clarifying that for us. We do have a question that is here on the chat that is coming from Kristen to both Richard and Luwana, and it says, I'm curious about your process for developing a shared language for the work you do. and for how you communicate with different partners, given the diversity of your core and support teams and other partners and groups. That is, co-designed language is important so that all groups are on the same page with respect to how things should be communicated and to ensure everyone understands the processes and research. Can you speak about this?
Yeah,
That's an
maybe.
awesome question.
Yeah, it is a great question. Maybe I'll share a little bit and maybe you can add to it, Luwana. I don't I don't think we have a specific process written down about how we do this, but um, I think for me, like even before I got involved in Indigenous health research, I can't remember who it was, but someone told me that a good researcher should be able to explain their research to an 8-year-old. And I think that's just so valuable. Like in any research realm, we should be able to do that. It doesn't have to be so complicated and full of jargon. So we know that in the community in our work that we if we really want to connect with the people that we're working with, we can't be talking in this very Western academic way of talking, right? We need to speak the language of the community. And I think we try and do that a lot. We think it's really important to include Cree language in a lot of what we do, and we have descriptions of our research projects that are in the language and that are in a really like community relatable way. The Deadly Dads Support Society is like a really good example of that. It's just the men were getting together. We had like a really kind of Western academic grant type name to the work, and they were just chatting amongst each other like what it's like to be a dad, and they said that that's deadly, and in the community that like that term deadly means a good thing, like it's cool. It's awesome if you're deadly, and they're like, yeah, we should call it Deadly Dads. So I think it came from just bringing community members together and just listening to them, and we do a lot of that. We do a lot of community engagement, and talking to community partners about our work, so we get a lot of ideas about this from them.
Mhm.
Luwana.
Yeah, so like just like Richard said, we communicate, engage a lot with our community members and our partners. And so we have meetings with our iHealthy Community Advisory Committee. And so we receive a lot of guidance and support from the iHealthy CAC. So that helps us to kind of get on the same page with, vocabulary and the wording that we're going to use in the community.
Yeah, that's a really good point that I didn't mention. Like a lot of our um, community facing documents, whether it's like a consent form or a survey, we'll start with reviewing it with our community advisory committee members. So community members and elders from the community, and they help us so much with the language that we're using. And if we create something like a interview guide after the CAC has, helped us revise it, we'll always test it out with community members to like see if it reads well, that it's understandable, that it's relatable, and we always get a lot of community feedback that way too.
Amazing. Thank you for that wonderful answer, because quite honestly, consultation is everything. That's what we need moving forward. And you guys are setting a wonderful example of that with the Wâhkohtowin Research Group. And that's just fantastic. We're getting to the last 2 minutes here. And I'm just wondering if there's any other questions. Otherwise, we'll just do a great big thank you to both Richard and Luwana for joining us here today and for sharing all of this wonderful information. I just had one quick question just before I was writing down so many questions, and I'm glad some of them were actually asked here. But what do you feel is the most impactful research project that you've worked on with this research group?
That's a really good question. My favorite was Aging Well, but as to like meaningful, I think this one is, because we've heard, in the community, we've heard, moms feel isolated, dads feel isolated. There's so many community members who don't know like how to access elders or ceremony, and how to learn, how to receive those teachings. And so it's really great to be able to create this safe space for community members to, access the strengths that exist in the community. And so for me, this has been a really meaningful, exciting, wonderful project to work on.
That's so good to hear. I agree. I think you guys are doing an amazing job, and I'm so thankful that there are people and researchers like yourselves that are willing to put in this hard work to benefit all the communities, and address really all of the different aspects of Wâhkohtowin and how we are all related. So thank you again for everyone for joining us here today. Just a reminder that if you have any questions or would like some more information from Michelle about our grants and how to join part of these research groups and be part of that, you can just stay online and we're happy to answer any more questions. But otherwise, hi. Kananasko Matin, hi, and thank you both, Richard and Luwana, for sharing your valuable information today.
Thank you.
Thank you.